Good afternoon. I'm Dr. Terry James Gingrass, and this is Dr. G's ADHD Chat, the show trying to make the world safe for ADHDers. I am a clinical neuropsychologist and psychologist, and in private practice still. Not, I've purposefully reduced the size of it, and I'm also the parent of Paul. Well, we know at least one child. We're thinking probably two. Um, and my wife has just somewhat hesitantly started to identify herself as an ADHDer. She has a brother who's ADHD. We have two nieces that are ADHD. I mean, it's kind of everywhere. And considering up until about 1980, we didn't even have a name for it. So I came into this totally with my eyes wide open, but probably my brain a little shut off. But in the last 5 or 6 sessions, I have been talking about the substances of abuse. And there is one huge glaring abnormality in all of this that we need to get to. Somewhat surprisingly, individuals that are put on people with ADHD that are treated with stimulant medication do not go on to become drug abusers. The people with ADHD who tend to go on and become drug abusers or alcohol abusers tend to be people who are not under treatment. Well, okay, and I don't know how many parents I've had, but won't that lead if she starts on or he starts on? No, it does not lead to substance abuse. Matter of fact, it makes it less likely that your child will abuse substances. I mean, I think the big thing we've got to remember is that ADHD is, after all, a neurologic condition, and it's caused by either lower production or more rapid metabolism, we're not really sure, of, at least we know pretty squarely, dopamine and norepinephrine, both of which have to do with attention, concentration, memory, all those things. And an ADHD kid who is got a low level of norepinephrine and dopamine is uncomfortable, especially when you put him or her into situations like school, where they are expected to sit quietly, concentrate, learn stuff, memorize things, and so on. That's uncomfortable. So one of the things that reason we think stimulants work is because they stimulate the production of those neurotransmitters, norepinephrine, dopamine. They once you get it stabilized, I'm not going to say starting out it's all that comfortable or anything, but once you get used to it, once your physician has figured out the dosage, then an ADHD kid on medication is pretty comfortable relative to a kid who's not on any medication and is just running around getting into trouble because he's doing all these hyperactive things, which is an effort to stimulate the production of norepinephrine and dopamine naturally. Okay, exercise will increase dopamine, norepinephrine. Okay, John Ratey, psychiatrist at Harvard, he swears by that. And he claims that an hour or so of aerobic exercise is good for 8 hours of increased concentration. I think that's a little bit optimistic, but I mean, he's got to be pretty close. It's at least 4 or 5 hours. So, I mean, and I have read or talked with a lot of ADHD adults who are very productive, and most of them swear by exercise as helping them stay focused. So that's a good thing to know, and it's also a good thing to start implementing with your own child, even if it means you have to go run with him. Okay, but so a kid who's got ADHD and is not in any treatment for it is uncomfortable. Okay, there's no way that school and all the other things where you're supposed to sit quietly are going to be very comfortable for that young man or young lady. And so, why so much substance abuse? Well, basically two reasons. You got the whole impulsivity thing. Hey, you ought to try this. It's great. Boom, without thinking it through. Okay. The other thing is that if you're uncomfortable, you're looking for something that makes you more comfortable. And so a lot of times, they're trying to treat themselves. I mean, I know I can't even count how many people, some of them adults, some of them teenagers, have told me, Doc, the only time I feel normal is when I've been smoking marijuana. And okay. But, nowadays it's not such a big deal since marijuana is becoming largely accepted. But, before you could get yourself in the hoosegow for a long period of time. And the thing that always amazes me about substance abuse, especially illegal drugs, is that people will buy this stuff from some guy standing on a street corner and put it in their bodies and not know where it came from, how it was produced, what it was mixed with, any of those things. And think, oh, this is okay. This makes me feel good. Well, some of the things they put in also kill you. But that's me just being hyper-logical, I suppose. But, and I seem to be a ADHD. I don't know what exactly to say, but somehow my life has become entwined with ADHD stuff. And mostly I've always been able to concentrate like a son of a gun. And sometimes causing my father some concern. All you do is sit there and read. Why don't you, Okay. Anyway, so if your child is on medication and it's all stabilized, and remember, it takes a while to get the right dosage and even the right medication in some cases. So don't give up hope, and don't say, oh, this crap doesn't work, because it does work for most people. Okay. The problem, well, there are money problems with trying to find the right dosage of a medication, especially for ADHD, is because it's not, some things you can say, oh, well, you're 6 feet tall, 200 pounds, you need this much. And you're 5'2" and 98 pounds, and you only need a little bit. But it doesn't work that way with ADHD. I mean, I have seen big old linebacker-sized guys who are on the lowest dosage of a stimulant that you could get, and I've seen skinny little 12-year-olds that are on the highest dosage you can do. So it's a by guess and by glory. You have to do it empirically, as they say, which means you got to try it and see how it works, and then adjust it. And we have a problem. Okay, ADHD until the 1980s didn't even have a name, and it's still we have a lot more providers in the world who are not really sure what they're doing with ADHD than are. So you can't just assume that because you got you're an MD or you're a LPN or anybody who can write prescriptions that you necessarily know what you're doing with ADHD. So you do have to be careful about that. You have to shop around, check with other people who have ADHD children, and find out who is good and who did well with their child, because it's a tricky uh, it's tricky figuring out the dosage mostly. Figuring out which medication, that's a little less tricky, but um, it's not, well, I mean, any kind of a provider can probably, say, oh, well, we'll use, like, I happen to be in the Adderall part of the world. Everybody uses Adderall. That's not necessarily because it's better than anything else. Just seems like that's what everybody uses. And once everybody starts using it, once one of the leaders starts using it, everybody falls in line. And there's no harm in it. I mean, it works pretty well for a lot of people. But that's one of the things you have to be careful of, is that you don't give up prematurely. You have to work to get the right medication, first of all, and then you have to work and get the right dosage. And there are also other medications than just stimulants that work with ADHD. There'd be arguments about whether they work as well, but basically, you have to work it out. Yeah, I mean, you have to be willing to experiment. There's just no other way of putting it. The other, and it's probably the smaller part of ADHD. ADHDers are uncomfortable. They're looking for some kind of relief, so they experiment with different medications, and that is not a good thing. A lot of sometimes they decide that something is helpful, and they start doing more and more of it. So pretty soon I've seen folks who are alcoholic, who, if they didn't have friends, they'd be dead, because they just drink, and they drink so much that they go to their bed and they just stay there. And if you know anything about alcohol withdrawal, you know that that's more dangerous than withdrawing from heroin. I mean, it can be nasty. People can die. So you don't just lock the bedroom door and slide breakfast under the door, to keep them going. No, you need to be careful. That needs to be medically supervised. So of course, we have pretty much taken that away. The treatment of alcohol withdrawal is not well regulated. Matter of fact, the insurance companies are regulating against it. So you get this deal where they bring a guy into the hospital for 3 days and then give him a prescription and tell him to be on his way. Oh, and by the way, don't abuse the prescription. That's just to kind of help you get down without going through withdrawal. Okay, and used to be, when I was in graduate school, I did an internship in a VA alcohol treatment program, and we kept people as long as they needed to be kept. Okay, so sometimes, basically what happened is they swept them up off the sidewalk in South Tucson. They brought them to us. They were spent 3 or 4 days going through acute withdrawal, medically supervised, that sort of stuff. Then they would go to us. And sometimes, they'd come in and they'd just be like shaking, and not talking or anything. And alcohol rehab is usually a lot of group work, so we'd have these group meetings, and those guys would be there for 2 or 3 weeks, and they wouldn't be saying a thing. And all of a sudden one day they get, "Hi, my name is Ralph. I'm an alcoholic." And, that would be the first time most of the staff had heard them talk. It is a scary thing. I mean, it really is. But the advantage we had back then is we could keep them as long as we wanted to. Nowadays, you're out. You got a handful of pills and you're on your way. So we get a merry-go-round kind of effect, which is not good for anybody. Okay, but the two things that being on medication help that we know of, it makes people more comfortable. They know that they have better control of themselves. They know that they are able to concentrate and sit still and that sort of stuff more comfortably. They probably aren't all that aware that it's chemically we're boosting their ability to produce dopamine and norepinephrine, but that's the effect. And also because they're on their under treatment, and not as uncomfortable, and their dopamine and norepinephrine have been boosted, they're not going to do as many impulsive things. And some parts of getting addicted to substances have to do with trying to feel better, trying to self-treat, and some parts of it have to do with just impulsive moves. Oh, the kids over on the corner there are doing this, so why shouldn't I? Kind of thing, without thinking about it. Okay, so that is, I think, the last thing I'm going to say about for at least a while about substance abuse and ADHD. I do think, regardless, of your fears and that sort of stuff, that if you have an ADHD, you should be looking at medications. At least look at it, give it a shot. I mean, just because you get a script written for your child doesn't mean you have to finish out the script. You can try it, and if it really doesn't seem to be working for you. But the thing you've got to remember is that expectation is a huge part of how medications work. Okay, now I speak as a psychologist with a lot of behavioral medicine training and that sort of stuff. And so I can be seen as being prejudiced about people's control over themselves, I guess, to put it into a better way, or for treatments that basically don't require a lot of medications. But this is one I think you've got to be looking at treating it medically. I mean, it's just the pain ADHD causes is extremely high. And I speak as a veteran of the wars. I have been through this with my own, and of course with a ton of my patients. It's not comfortable. The world is not set up for ADHDers. Certainly schools are not. And a lot of the world is not. And if you're an ADHDer, you need to be thinking about and you're about to graduate from college and stuff, you need to be looking at getting a coach. Okay, I'm going to say that I am a coach, but I think you need to understand that if you aren't in the right place with the right kind of job, with the kind of a job that accepts that you're a little bit different, that you're maybe a little more creative, maybe a little brighter, maybe a little more scatterbrained than the average person. That does not mean that you can't be terribly successful, and a whole bunch of ADHD people are, but you've got to be in the right position. If you're in a position where you're not appreciated, where they don't want any creativity, they just want you to, do this, do that, do this, do what I tell you to do, kind of thing. Well, you're just going to have some problems. So, as a parent, you need to be encouraging that as they get closer and closer to moving out into the world. Okay, I am Dr. Terry James Gingras. This is the Dr. G's ADHD Chat, the show trying to make the world safe for ADHDers. My website is terrygingrasphd.com. You can sign up for my list there. Pretty soon I'm going to be offering some things. We'll talk about those later. Because I like this field. I find it really fascinating. This is. Came into this not knowing much about it, honestly, and then because of my kids, I had to learn a whole lot about it, and then I started seeing those patients, ADHDers as patients, and I'm still real interested in it, and I know there are a bunch of ways that ADHD can be handled, okay? But as a parent, it's way more work and there's way more of a a load. You have to do more than you did. Most of us, my first kid, I just kind of reacted to whatever happened. But with an ADHD kid, you got to be anticipating. That's why my book is called Strategic Parenting, not tactical. Okay. We'll talk about that later on. Okay, we'll catch you next week. And remember, the world needs outside-the-box thinkers like your child. Okay, but they have to come into the world confident and flexible, and able to tolerate some mistakes and things. Okay, see you again.